Hey guys, Dr. Nate here at Thrive Dental Orthodontics, and I'm going to show you our office behind the scenes. You get to see everything that we see. So let's see, can we do this in one take? We will try. So this is the front lobby at our at our Allen location. You can see we try to decorate it beautifully. That is my wife, Dr. Christine, who does all the decorations here at all the offices. She is the brains and the beauty behind all of this. So like I said, we're trying to keep these absolutely beautiful. All of our stuff is digital, so we don't like you having to fill out too much stuff with paper. We don't like paperwork. We're trying to conserve the environment. We have laptops and you can fill out paperwork on your phone. We're just trying to make it as easy and convenient as possible for you. So this type of stuff, you guys are all seeing if you come to our offices, because it's basically, you know, what all the patients see. You see the computers, all that fun stuff. This is all pretty normal. Let's kind of walk you back to where we take some of the x-rays. This is a couple x-rays we take here. So I want to explain this because you guys probably get this done and don't really know what it is. This is called a panoramic x-ray. And that's the x-ray that is a kind of 3D or 2D image of a 3D object, which is your face, but it allows us to see the wisdom teeth and all sorts of different structures in your face. This one pretty much everybody does. This one right here is called a cephalometric x-ray. That is mainly for me, mainly for orthodontics. We put your forehead here. These little things, this is where the ears go into these little things right here. And that takes an x-ray from the side. And that is mainly used in orthodontics with Invisalign and braces. And that just helps us see where the teeth are going to protrude or go back. This is another type of x-ray. So you guys probably get this done. You probably don't know what it is. This is for the general dentist. This is called a NOMAD. It is very great because the radiation is so little, and that's why we love it so much. So this goes in and takes individual x-rays. So this thing here actually emits radiation, which is interesting. And then you have a sensor on the other side, and that's how we capture that information. These x-rays, the radiation is so little, you actually get more radiation if you're flying. It's kind of crazy. Did you know that? So that is the x-ray portion of it. Each operatory is pretty much the same. All of our operatories have TVs on the top. They have TVs on the side. And why do we do this? Number one, we want to entertain you. So if you're coming in, you're gonna get to see Netflix, all your favorite shows. On top of that, we get to show you x-rays and pictures of your mouth. So we don't just walk in and say, or our dentists don't walk in and say, oh, you have X amount of cavities, and that's it. We show you everything. So you see everything. You see those dark stains on the teeth. You see why you need deep cleaning. It's very obvious because we have pictures and x-rays, and it's blown up there. So you definitely see it. So every operatory is pretty much the same at all of our offices. So all of that stuff you may have seen before. You probably hadn't had to explain to you quite in the same way, but let's show you a little bit more behind the scenes. I'm going to turn on the lights here because the lights are turned off because nobody's here. It's Saturday. So this is the sterile area. So this is stuff you probably don't see before. I'm going to have you direct right here. This is called an ultrasonic cleaner that helps get off all the debris from all the instruments. So this is the flow. It kind of goes dirty to clean. So this is the dirty side. So I don't like to touch it very much. So the dirty side here, we have all these instruments. Don't worry, they're in the bag, so it shouldn't be too dirty. This is something that they use to take out teeth. You can see there's no blood on it because everything was cleaned before it got to this point. We put the bags on it, and then it goes in the autoclave. The autoclave uses super high temperature and high pressure, along with some hydration to clear off or kill off all the bacteria, all the viruses, and all the spores. Viruses and spores, those are the hardest things to kill, but all that pressure and that heat kills basically absolutely everything. So that's how it goes. And it goes from here, and then we put it on here. When we first take it out, the instruments out of the autoclave, it is scorching hot. So that's why we gotta let it cool down for a little bit before we bring it to the patients. Then even further back, we got all of our fun stuff. This is the stuff you definitely don't see. So in the back, we try to keep this organized as possible. The girls are on vacation for a few days, so it might not be as organized as we always have it. But you can see here, this is all the stuff that we use on all the patients. So you have stuff like Ceticaine, which is something to numb you up. You have the needles, which you guys probably don't like if you're out there. You have all these micro brushes, all these impression trays, all these prophy pastes. You have the toothbrushes, cord, sealants, composite, all that good stuff. This is all how we keep it organized at our offices. So there you go. That's pretty much the whole behind the scenes. The other stuff isn't that interesting. It's like where we hang out to have lunch. Nobody cares about that. So that is how our offices are organized here at Thrive Dental and Orthodontics. And if you have any other questions or comments, please let me know. If you think this is interesting, please let me know. And if you have other subjects you want me to cover, let me know that too. So I will see you guys in the next video.